Erica Littlewolf, who is on the Northern Cheyenne and works for Mennonite Central Committee, Central States with the Indigenous Visioning Circle. She is committed to the work of decolonization, authentic relationships, and healing. And with her BS in psychology and American Indian studies, she applies her education to social justice issues and how they impact Indigenous people. Erica grew up in Busby, Montana, so we've got a Montana State person with us today, very excited about that, and has traveled extensively across the country and indeed around the globe. Her role, she's contributed to the United Nations Permanent Forum on Indigenous Issues. She's known for the excellence, the insight, and the good humor she brings to all of her engagements. So please join me in welcoming Erica here to the University of Montana, even if virtually so. Welcome, Erica. So good to have you with us today.
Welcome to my name is Erica Littlewolf. I'm originally from Busby, Montana, on the Northern Cheyenne Reservation. So my anti-racism journey, I grew up on the reservation, but going to a predominantly white school. And I'm mixed race. My mother is Jewish and my dad is Northern Cheyenne. So I had that experience. When you look at it and when you listen to the news, they will say things like, it's a pandemic, something with this, like we've never experienced in the United States. And it's actually not true, depending on where you start the story. Maybe for Europeans it's true, but for Native people, we have had pandemics since the arrival of Europeans. And so when COVID first came out, a lot of the elders on the reservation were scared because they remember stories of when smallpox came in, and then they remember when tuberculosis came in. I remember my dad relaying stories of his mom telling him stories of people just dying at such high rates that they would line up in wagons at the cemetery and wait in line to bury their loved ones. And so people immediately got scared because they knew what that meant. And what that also means is we're getting all our information from the government. Like, why would we trust this information from the government when they were the ones that initially brought these things to us? And what it also means is that since we haven't had access to healthcare, we haven't had access to healthy food systems. If you look at the statistics, people of color and Native people are disproportionately affected by COVID. We're dying at higher rates, we're being hospitalized at higher rates. So you may start thinking like, maybe there's some biology to this. Maybe people of color, Indigenous people are more prone to this disease, but the reality is that we haven't had access to healthcare. And so these predetermined or whatever conditions, you know, like heart disease and all these other conditions that make you more vulnerable to get this disease are because we haven't had access to healthcare or we don't have healthy food systems. And so that is all for Native people, that is all because we were forced onto reservations. Our buffalo were systemically killed. We live in food deserts. We eat commodities, which are high in fat. I'm only meant for times of famine, but we're eating these every day, which cause liver problems, which cause other problems to your health system. So then you bring in a pandemic and you have people living in houses that maybe house 20 people, and all you need is one person to get that disease and it will spread. There's no such thing as being able to socially isolate. So then that adds to a problem. How it spread so fast in the Navajo Nation is the main protocols they had were like to wash your hands. A lot of people in the Navajo Nation don't have running water. So how exactly are all these protocols you put in place going to work in these kind of communities? And so it's been really interesting to watch how the news and even the CDC reacts to this pandemic. A lot of their advice is irrelevant, not relevant to Native communities at all. It just does not work. the mask wearing, I feel like the grandmas have gone crazy with it. Like they are blinging out their masks. So that's like no problem. Like the jokes on the masks, like they are hilarious. Like I think I had jury duty and everyone had masks on, but they were like, we need to make these bigger because we have native cheeks. Like these aren't made for our cheeks. And then someone was joking around about it, and one of their little elastic things like popped. And it was like the mask was like hanging sideways. It was so funny. But it's like, we don't have a problem wearing masks, but it is kind of true. Like if they don't fit our cheeks. But yeah, so COVID has really hit us hard. We got hit about late July, early August, so it took a while. And now we're up, I think, into the mid 200s with our numbers. Last week we had 3 people die in one day. And now it just seems like daily people are dying, and we only have about 4,000 people on the reservation. So everyone knows everyone knows of everyone. And if you think about it, it's a hard grief because we only have 300 people left that speak our language. And so when those elders die, it's a culture dying, it's a language dying, it's a history dying. It's essentially America's first people, these people, I mean, these cultures so vibrant, a piece of those are leaving with every death. And it feels like, I don't know how people, if they value libraries, it feels like these living libraries, every time someone goes is just passing away. And we feel that every time a new death happens.